My name is Rodora Cepeda, and I'm a physical therapist. And my background is in outpatient and home care physical therapy. And I see patients of all ages, mostly geriatrics. And this lecture is intended for physical therapists or other clinicians who are seeing patients with ineffective breathing patterns.
Physical therapists evaluate and treat patients with ineffective breathing patterns resulting from pulmonary dysfunction, pain from surgery, trauma or disease, musculoskeletal dysfunction, neurologic impairment, debility, metabolic disturbances that have compensatory response, and apprehension and nervousness. Understanding the ways in facilitating effective ventilation will empower physical therapists in incorporating breathing techniques and ventilatory movement strategies in their rehabilitation program to get their patients healthier quicker and assist them in reaching their greatest rehabilitation potential. During this time of pandemic, patients who are positive of COVID-19 are struggling to breathe. That ventilatory strategies and breathing control techniques can be the key to maximizing potential. This short video lecture will discuss the variety of therapeutic interventions to optimize ventilation patterns. No single technique is appropriate in all cases. Sound clinical judgment and experience must be exercised when applying these ideas with each patient. The aims for this lecture are to present and demonstrate therapeutic interventions to optimize ventilation patterns, and the categories are positioning concerns, ventilatory and movement strategies, manual facilitation techniques that include facilitating controlled breathing patterns, mobilizing the thorax, facilitating upper chest breathing patterns, promoting symmetrical breathing patterns, and reducing high respiratory rates. Time is limited for this lecture, so this is more of a summary for each of these interventions. I will be showing short video clips for some of the interventions. The first step in facilitating any breathing pattern is to position the patient for respiratory success. Goals for positioning are to assist in clearing secretions passively, to provide for skin relief and better circulation through position changes, to assist in retarding the development of joint contractures or other musculoskeletal abnormalities. Often, the patient's posture and pelvic position has a dramatic effect on breathing. Simple adaptations may make ventilation easier. Here are some techniques for patients to spend some portion of the day in a horizontal position for rest or sleep. In supine, placing the arms up over the patient's head facilitates greater upper chest expansion. Likewise, positioning the pelvis in a slight posterior tilt facilitates more diaphragmatic excursion. The next consideration under passive respiratory techniques is proper wheelchair positioning. Optimal performance in respiratory functioning as well as many areas of rehabilitation depends on good alignment of the body against the forces of gravity. Patients who lack postural control may improve their ability to ventilate with proper thoracic positioning in sitting. A patient who sits in an excessively flexed position can compress the contents of the abdomen against the diaphragm, causing breathing to be restricted. Use of abdominal support from the iliac crest to the base of the xiphoid process provides positive pressure support to restore intestinal positioning in an upright position. Observation of all precautions and contraindications to passive positioning is still warranted. After the patient has been carefully positioned for respiratory success, the clinician must actively include respiration in every single activity to help the patient understand that breathing transcends all activities. Our goals for ventilatory and movement strategies are to encourage increased inspiratory and expiratory capacities, to develop early functional motor planning strategies and facilitate early trunk mobility, and to discourage the development of Valsalva patterns or shallow breathing patterns when motor activities become more difficult and complex. As discussed in Part 1, inspiration and expiration are naturally associated with movement patterns, and to pair them together during daily activities. The goals for facilitating a controlled diaphragmatic breathing pattern are to decrease the work of breathing, to improve alveolar ventilation, to improve airway clearance by improving cough, to increase strength, coordination, and efficiency of respiratory muscles, to teach the patient how to respond to and control breathing, to assist in relaxation, to mobilize and maintain mobility of the thorax, and to enable patients to feel self-control and confidence in managing disease or dysfunction. We have several diaphragmatic facilitation techniques, and this video clip is about the relaxation technique. So place your hands on the shoulders, then ask the patient to shrug shoulders up into your hands and hold it. Don't let me push your shoulders down is the command. Then let your shoulders relax, let them go. The emphasis is on the relaxation phase. The goal for mobilizing the thorax is to mobilize individual rib segments to gain the potential for chest wall expansion in all three planes of ventilation before facilitating a specific breathing pattern. Anterior chest wall mobility can be improved by placing a vertical towel roll down the length of the thoracic spine and allowing gravity to pull the shoulders back to the bed. In this position, the anterior chest is open up, placing the intercostal and pectoralis muscles on stretch for easier facilitation of upper chest expansion. The goal for facilitating accessory muscles in ventilation is to promote use of accessory muscles for efficient breathing patterns for the neurologically impaired patient. Facilitating greater posterior chest expansion can be achieved in a prone on elbows position, deep breathing during the push-up, and to exhale the air when returning to the starting position. The serratus anterior muscle causes lateral scapular movement, thereby facilitating maximal posterior excursion of the thorax. The goal for promoting symmetrical breathing patterns is to facilitate weaker side of patients with a symmetrical dysfunction to promote symmetrical chest wall expansion in both the upper and lower chest. A technique to promote symmetrical chest wall movements is performed in numerous postures such as supine, sitting, or standing. Hands are placed symmetrically on the lower lateral chest or on the upper anterior chest wall. At the end of exhalation, the therapist gives a quick stretch on the muscles being touched to facilitate a deep inspiratory effort in that area of the chest. Immediately after both sides begin to move into an inspiratory pattern, the therapist manually blocks or inhibits expansion of the chest on the stronger side while giving continued quick stretches on the weaker side. This facilitates greater expansion on the weak side by use of an overflow response. The goal for reducing respiratory rate is to increase tidal volume to decrease respiratory rate to restore ventilatory efficiency. The use of butterfly technique promotes deeper inhalations and exhalations, where the shoulder flexion and trunk extension are paired with inspiration, and shoulder extension and trunk flexion are paired with exhalation. Thus, it becomes possible and probable for the patient to increase their tidal volume and decrease respiratory rate. This quick and easy suggestions for positioning, manual facilitation ideas, and techniques are additional interventions to incorporate in the rehabilitation program. Not all techniques would be appropriate for any single patient. It is up to the therapist or clinician to determine which techniques would best address their patient's deficits. To learn more about the manual facilitation techniques and strategies, please refer to the reference list in this section. Learning is a lifelong process. What we learn today may be obsolete within a few years. Thank you so much for all the volunteers that willingly participated in this project, to my BFFs, Livy, Babes, and Melly, for letting me come into your home in this time of pandemic, to my patient Dwayne, to David, our yard guy, and to my husband who patiently shot the video. Special mention to Dr. Litos for your guidance and positive comments. Thank you so much.